A very good evening, all. I am the Lamba with the Tues edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 114 million cases of COVID-19 with more than 2.5 million deaths. Here in the United States, we are at more than 514,000 COVID-19 deaths with nearly 29 million cases. A good news though, a third COVID-19 vaccine has been authorized by the Food and Drug Administration. The Johnson & Johnson single-dose coronavirus vaccine will start being administered this week, and this vaccine could be a game changer in the supply chain, getting shots into more arms across the nation. In politics, a lot is happening. The House of Representatives passed President Biden's massive $1.9 trillion COVID-19 relief stimulus bill, and the legislation now has moved to the Senate. The Biden administration will likely need all 50 Democratic senators to get it passed. Meanwhile, today saw the first public testimony of FBI Director Christopher Wray, where he first time testified before Congress on what happened before and during January 6th Capitol insurrection. At least 250 people have been charged in connection to the attack. On politics and coronavirus updates, we bring to you tonight elected representatives, doctors, and community leaders discussing several pertinent issues. Here are the headlines. Dr. Lisa Tang on coronavirus updates and measures, Chief Medical Officer, Hackensack University Medical Center. Asian American Federation organizers Rise Up Against Asian Hate Rally, New York City. Indian American Kerala Center presents virtual seminar on COVID-19 health issues and Frontline Heroes recognition. It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome again. I am Aditi Lama, and this is Vision of Asia, Tuesday night episode of South Asian News. Let's now take a look at coronavirus updates and measures. More contagious variants of the virus are circulating in the country with the potential to push case counts upward again. COVID testing has fallen in the recent weeks, leaving experts worried about how quickly the new outbreaks will be known. This is happening while millions of Americans wait to be vaccinated with now a third vaccine, the Johnson & Johnson single-dose COVID-19 vaccine authorized for emergency use, is hoping to speed up the slow vaccination program in the nation. Meanwhile, Director of the CDC, Dr. Walensky, said she was really worried about the rollbacks of restrictions in some states and cautioned that with variants spreading affecting the decline in cases, we stand to completely lose the hard-earned ground we have gained. So what should we do right now to protect ourselves? We spoke with Dr. Lisa Tang on this and much more. Dr. Tang is the Chief Medical Officer of Hackensack University Medical Center. Here is the conversation. Today, we are at more than 28 million cases in this country with at least 514,000 deaths. In the world, we are at 114 million cases with at least 2.5 million deaths. My first question to you is, we keep on hearing that there's a downward trajectory of cases and deaths going on. However, the numbers are so large. How do you look at it?
So I think it is important to keep that perspective. Yes, overall numbers are down compared to COVID 1.0, if you say the first wave. But recently, if you've seen in Northeast, we've continued to see our numbers fluctuate. It varies in different times. It also varies with different events. So if there have been large gatherings or holidays, we do tend to see a bit of a spike. Recently, I think here, definitely in the Northeast, we haven't seen the numbers trending down as we would like to see them by now going.
Even more. So when you are looking at these numbers, Doctor, are you at all concerned about a fourth surge of COVID-19? We're hearing about these variants from the UK, South Africa, New York has its own now. How much of that is going to impact these case numbers and deaths?
So I think we are always worried about the next surge. I think the most important thing I would say is being very vigilant, even if you are vaccinated, to make sure that you don't gather in large crowds. You continue to have physical distancing, wear your masks, hand washing, cleaning your surfaces very diligently. I think those are really crucial. The variants have always been there. We are much more cognizant of them. Especially the New York one, I think the infectivity rate is higher, so your likelihood of getting it is higher. So the goal really is to make sure that we continue to stay vigilant, we continue to comply with CDC guidelines, and to make sure that we keep ourselves and the folks around us safe by getting vaccinated.
Doctor, what exactly are these virus variants doing to the virus itself, and what is it doing to the body?
I think it's the variants. What they do is the efficacy of the vaccinations definitely get affected, but at the same time, the variants are very similar to as we see in flu, correct? That you can have different types of the flu variant. So if you've been exposed to one, doesn't mean you might not get infected to the other one. So it continues to challenge your immune system, but at the same time, it also tells you that just because you have had COVID in the past doesn't mean you might not get COVID again, and your immune system might have not seen this particular variant. So I think that's an important thing to remember, that it is always mutating and evolving, and we need to make sure that we continue to keep our vigilance.
In the next coming months, come spring, Doctor, are you seeing these variants impact the trajectory that's going downwards right now? When do you see it become the most prominent right now?
You mean the
variants? When would they really impact us?
I think the variants are very much already evolving and mutating. We saw them in March, we saw them in the fall, and we continue to see them in the winter months. I think the goal is going to be really making sure that everybody gets vaccinated, irrespective of which vaccine we take, in order to keep ourselves, and again, as I said, the folks around you safe. And it's going to really depend on how we are responsible when we are in the community and we are outside, that we continue to maintain our vigilance and masking and keeping our physical distance.
Right. Experts are also saying, Doctor, that age groups of 20 to 46 might be responsible for the ongoing surge in cases that we're seeing in some states. And in general, too, they're saying that one age group is very crucial right now. What are your comments on that?
I think that is the age group that the likelihood of having asymptomatic shedding, as we call them, is that they might not show all the symptoms of COVID, but they can continue to transmit it. I think that's also the group that likelihood of socializing and colleges and gathering in crowds. I think that is another reason. But it is important to remember that it could be any age group. It could be anyone that could be shedding without realizing that they even have COVID. So irrespective of the age group, COVID doesn't differentiate between age, doesn't differentiate between genders. I think it is each of our responsibility to make sure that we curtail this.
Yeah. More on coronavirus and its awareness, the Indian American Kerala Center organized a virtual seminar addressing COVID-19 health issues and honored frontline hero medical professionals and first responders. The center proudly promotes Malayalam language and literature while serving the Kerala Indian American community needs and accomplishments. The virtual event saw appreciation of 100 healthcare workers and police officers from Queens and Long Island in New York for their service during the pandemic. The recognition ceremony was followed by a seminar and a panel discussion featuring experts and doctors on prevalent issues related to COVID-19 and the South Asian American community. Here are some highlights from the virtual event presented by the Indian American Kerala Center.
It is a great pleasure, and I am so proud to host this meeting for honoring our sisters and brothers working in the medical field and us first responders who sacrificed so much in these difficult times. You deserve our appreciation. കേരളത്തിലെ ഗ്രാമപ്രദേശങ്ങളിൽ ജനിച്ച് നേഴ്സിംഗ് പഠിച്ച് അമേരിക്കയിലേക്ക് കുടിയേറി സൂപ്പർ പവറായി രാജ്യത്തിന്റെ ഇൻവിസിബിൾ ശത്രുവിനെതിരെയുള്ള യുദ്ധത്തിൽ മുന്നണി പടയാളികളായ നമ്മുടെ സഹോദരി സഹോദരന്മാർ നമ്മുടെ അഭിമാനമാണ്. Many perished in this war, many injured, and they did not retreat. They persisted. They got up every morning and went to serve their fellow human beings suffering from the pandemic. That is an amazing act of bravery which we need to appreciate. ജീവിതത്തിന്റെ അന്തിമ നിമിഷങ്ങളിൽ ആരോരുമില്ലാത്ത കഴിഞ്ഞവർക്ക് ആശ്വാസം പകർന്ന് ഒരു കൈത്താങ്ങായി നിന്ന കാവൽ മാലാഖമാരാണ് അവർ. അവരുടെ നിസ്വാർത്ഥമായ സേവനം നമ്മുടെ അഭിനന്ദനവും അംഗീകാരവും അർഹിക്കുന്നു. നമുക്ക് അവരോടുള്ള സ്നേഹവും കടപ്പാടും നന്ദിയും അറിയിക്കുന്നതിനാണ് ഈ മീറ്റിംഗ്. We have several dignitaries and community leaders with us to express their appreciation. We have Honorable A.K. Vijayakrishnan sir with us. He is Consul for Community Affairs at the Indian Consulate in New York. അദ്ദേഹം കഴിഞ്ഞ വർഷം കേരള സെൻട്രലിലെ ഒരു പ്രോഗ്രാമിന് വരാനിരുന്നതാണ്. പക്ഷേ കോവിഡ് കാരണം അതിന് സാധിച്ചില്ല. കോവിഡൊക്കെ മാറി അന്തരീക്ഷം ശാന്തമാകുമ്പോൾ അദ്ദേഹത്തിനെ കേരള സെൻട്രലിലേക്ക് വീണ്ടും ക്ഷണിക്കുന്നതായിരിക്കും.
Thank you to Kerala Center for honoring our frontline heroes. A special thank you to Alex Estepan and the entire board for inviting me. I am honored to take part in this program today. Let me start off by saying a big thank you to all our healthcare workers and essential workers for everything that they did for us and continue to do to keep this pandemic at bay. I'm so very proud of all of you. We owe you so much. All of you are our heroes. We are all going through a very tough time with the spread of COVID, and most of you are very likely to look at the past year and even this year as one of the most difficult times in our lives, personally and professionally. This global pandemic has impacted all of us very hard, directly and indirectly. From a governance standpoint, my district in New York was impacted with the death of so many individuals, jobs lost, businesses shut down, and communities devastated. I've seen homelessness rise, food lines grow miles long, but we are going to get through this because we are Americans and because we have dealt with a lot of things. And because we're smart, we are resourceful, and we are united.
The Indian community and specifically the Kerala community achieved another recognition, being the frontline workers and doctors as frontline workers as doctors, nurses, and other healthcare professionals. You already heard from Kevin, our Senator Thomas, and Mr. Vijayakrishnan what the kind of work which they have been doing, and it's fit that we Kerala Center call this meeting to recognize them. Although we are only recognizing only some of them, while the total number is much higher. But it is we are conveying to all of them that we appreciate their work, we compliment, we thank you, and we pray for you in the kind of work which you are doing. I compliment Kerala Center for this great initiative, and I hope those who are not members of Kerala Center consider becoming a member.
Thank you so much. I'm not taking much time. COVID-19 pandemic, we all know about that. Our healthcare workers, they were in the front line and fighting for us. So this is a great auspicious occasion to salute them. On behalf of FOMA, I take this opportunity to salute them. We wish you all the best. Our prayers, support always with them. May Almighty God shower all the blessings, their day-to-day life. We salute them again and again. Thank you. Thank you so much.
എല്ലാവർക്കും എൻ്റെ നമസ്കാരം. Good evening, friends of the heroes, the frontline heroes, families, and all you out there, celebrants who we want to recognize today. First of all, I want to thank you, Alex Estepan, and the board of directors of the Kerala Center for putting this program together, such a worthwhile program, and for giving me the opportunity to share my thoughts. Well, it's been more than a year. It was February 3rd when the US government declared it a public health emergency due to the pandemic. And we're getting used to living in this pandemic-afflicted world. But grateful people from all nations have been coming forward to celebrate the amazing healthcare and essential service workers because they exemplified the highest level of compassionate concern and their civic responsibilities in extremely trying circumstances. So I, too, joined the Kerala Center and the guests and dignitaries of the community gathered here today to acknowledge, to applaud, and to appreciate all you healthcare and essential service heroes. Truly, these men and women are my newest role models because they epitomize service over self-centeredness and others before self. Well, thank you does not seem enough, and calling them heroes sometimes comes short. That said, I still want to invoke the good Lord to continue to bless each of the frontline workers richly. And may you continue to inspire and touch more lives as you have touched mine.
Well, it's time for the short break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I am Diti Lama, and this is Vision of Asia South Asian News segment. In New York City, the Asian American Federation organized Rise Up Against Asian Hate rally at the Foley Square. The Federation is the largest umbrella leadership organization serving diverse Asian American communities. The rally spoke against anti-Asian violence that has caused harm to vulnerable Asian New Yorkers, and the past few weeks have seen assaults on Asian elders in the city. The Asian American Federation, along with more than 30 co-sponsoring organizations, called on city and state leaders to invest in community-based solutions to ensure greater, more immediate safety, and urged them to stand up against discrimination and hatred towards Asian American community. Rise Up Against Asian Hate rally saw several elected representatives, including New York City Mayor Bill de Blasio, Senator John Liu, New York City Comptroller Scott Stringer, Congresswoman Grace Meng, and others standing in solidarity with Asian Americans. Here is the story.
Fellow Asian Americans and New Yorkers of every background taking a stand against the rise in attacks and hate crimes against Asian Americans. 1,900% increase in 2020. This has to end. It has to stop. People are being spit on. They're being stricken. They're being stabbed, slashed, and killed. And we need to put a stop to this spate of hate crimes against Asian Americans. People have made very powerful statements today, and what we need to see is people continuing to speak out, government officials taking action to protect people. Thank you.
We're here in solidarity with our brothers and sisters. We know what it's like to be discriminated at. We know what it's like to be a target of a toxic narrative around immigrant communities. So we're here because your pain is our pain, and we need to stand together against hate, because if we stand together, nothing can basically stop us. So thank you so much for having us and for listening to our voices, because we are your brother and sisters.
So I'm so happy to see all the people from the different parts of New York and the different races, Black, brown, South Asian, white, all here today to support the Asian community. And the one thing I would like to say, that if you see something, please stand up. Please, help the person who is being attacked. Please make sure that you take a video, because, the last person who was attacked, nobody ever helped him. And as New Yorkers, we should be helping each other.
We at the Federation thought it was really important to rally today against anti-Asian violence, because it's really deeply affecting our communities, and we're looking for community solutions to help bring resources to all of our Asian brothers and sisters so that we can feel safer in our community.
What is your name?
Howard Shih, S-H-I-H is the last name, first name Howard, H-O-W-A-R-D. I'm the Research and Policy Director at the Asian American Federation.
I'm State Senator Brian Kavanaugh. I represent this area in our state Senate as well as Chinatown. And I'm very happy to be here today to talk about how our community has to come together to fight racism and bigotry against any member of the Asian community, and how we stand in solidarity to prevent that.
Senator Brad Hoylman from Manhattan. I'm here because this violence against the Asian community is an epidemic across America. A recent study showed that hate incidents against Asian Americans have risen more than 1,000%, particularly in New York City and San Francisco. We have to put a stop to it. We have to put resources behind our communities and make sure that people are safe. Thank you very much.
What is your name, sir?
State Senator Brad. I'll give you my card.
Can you spell your name?
Oh, BradHoylman. State Senator. Thank you, sir.
You know, we're happy to, it was hard work to put together a rally in the middle of a pandemic, but we knew we had to do it because people are getting hurt. People who look like our community, they're getting brutalized, and we need to be able to say no, and we need to be able to show support. You guys, excuse me. We need to be able to show support for the victims, our community, our safety, and to make sure that we get the support we need to heal and to be able to, fully participate in our city.
We held this rally because it's really important for, our elected leaders to support resources to keep our community safe, as well as fellow New Yorkers to stand up for our, their Asian neighbors.
My name is Sharzad Shook, and I'm Southwest Asian American, first generation, and I live in the neighborhood, and this is my community. We are here at a rally against anti-violence against Asians, and we've heard a lot of different things today, and mixed political response from all the politicians, but the community, as a community member, what we are asking for is community-based support.
Everyone who has joined together to fight hatred. We will not accept hatred in New York City. Yeah. Stop Asian hate. This is the message we have to get out, not just in New York City, but all over this country. Stop Asian hate. Stop it now.
We're going to make sure that we let it known that when you attack one, you would attack the entire city. That is what New York is all about. And we will be here with you every day, every moment, to make sure that we bring to justice the people who view hate and attacks as a way of expression. We have a different view in this city. To prevent this from happening, to resource communities, to come up with strategies, to march with you, to fight with you, to bring about change, because we are not gonna let the haters hate. This is over, folks. You are not gonna get away with this. You are not gonna hurt people anymore. We are watching. All eyes on the haters. All eyes on every hater. Listen to what's happening today. We stand with you. Thank you very much.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Diti Lamba. Take care and be well.